sometimes we hear on our end as Infection Control University from an administrator like yourself, you've been in that role, I've already got this covered. My general contractor takes care of this. You know, how does that really work inside the hospital? Do they have it covered?
I don't believe they have it covered, and it's not those general contractors that are going to be on the front line of responsibility and perhaps in a lawsuit.
Good point.
When there's a problem with the patient. And so I always go back to that very basic scenario is, what do I need to do as an administrator to ultimately protect the patients and employees that are in my building? And if we do that in an optimal way, I sleep better at night. I just do. Because that could be my mother in the bed, it could be one of your relatives, it could be some of our friends and family members working in the building. And I think it's our responsibility to make sure that's done well.
And I appreciate that, because there are some points that ICU covers that most general contractors don't. For one, we capture all the maintenance type people that come into the facility. You know, you've been in there, it's the elevator technicians, the painter. They're not associated with the general contracting project, but they're in there doing normal work on an everyday basis. If it's even somebody putting in data wire, we're capturing those people, and those people aren't normally captured under the general contractor. And on top of it, the clinics, many of the clinics and some of the smaller rehab projects aren't particularly done by that same general contractor. Maybe a different general contractor takes care of them, and are they training them? And we're finding there's a big gap. The big contractors try to do some training and capture some of the people, and they do a good job. Any kind of training's good, but we've got to get everybody involved.
So I believe what organizations need to do is engage Infection Control University to provide that best-of-class solution that MDR has found and endorsed, and bring that solution to our colleagues to help drive hospital-acquired infections to zero and lower cost and risk.